My name is Cindy and I had the procedure done 9 months ago. I first noticed my back pain about 10 years ago. After years of downhill skiing, I started noticing a pain on my side and lower back, and sometimes went down my leg. I really noticed the pain when I was standing too long and cooking, but also when I would try to sleep on my side. I could maybe sleep for 2 hours and I'd have to wake up and move and try to get comfortable again. My pain was mostly a dull ache, but it was so constant. And then sometimes it would be a little sharper, and I was catching myself limping a little bit too and thought, this is not normal. I've always been pretty active. I was a downhill skier and line dancer, and I would go hiking, and I was finding I couldn't do a lot of those things the way I used to. The treatment that I tried for the pain, besides medicine, over the counter, went to physical therapy, had injections, I had RFAs, and they were all temporary fixes. That's when I started going to the doctor and asking questions and seeking solutions.
Hello, my name is Dr. Michael Cicchetti. I am a Board Certified Physiatrist at Buffalo Spine and Sports Medicine. I subspecialize in interventional spine, musculoskeletal medicine, and we are here today to talk about sacroiliac joint pain and a potential treatment option for SI joint pain. The sacroiliac joint is located in the pelvis between the ilium and sacrum. It is heavily involved in the transfer of forces between the upper body and the lower body. It has a very small amount of movement, and it is supported by some very strong ligaments and muscles. Sacroiliac joint pain is caused by a number of factors. From an injury, typical injuries include a blunt trauma such as a fall on the buttocks or maybe from a car accident. Women may be predisposed to SI joint pain as they go through pregnancy when the ligaments become more lax. Furthermore, arthritic changes can occur. When I see patients in my practice with sacroiliac joint pain, they usually complain of pain directly in the lower lumbar spine, unilaterally, involving the spine and upper buttock. The sacroiliac joint can also present with pain referring into the buttock and posterior thigh. Some patients may even experience pain that travels below the knee and even into the foot. Sacroiliac joint pain in a traditional spine and pain management clinic may be seen at a rate of 15 to 30%. If a patient has already had spinal surgery, especially a fusion, in the lower lumbar spine, the incidence of sacroiliac joint pain can be as high as 43%. Sacroiliac joint pain is kind of the big masquerader. It has overlap with other syndromes, so we have to be very cautious to exclude other potential pain generators. There are certain questions I'm going to ask a patient. Number one is I'm going to ask them to point directly to where they experience pain. The majority of patients with sacroiliac joint pain will point directly over their sacroiliac joint, but certainly there's other things we have to do. We need to ask them questions about what causes their pain, and then we need to do a specific physical exam. So there are several provocative maneuvers that we will do that are sensitive for identifying sacroiliac joint pain. We also have to exclude other potential pain generators. This will include physical exam of the hip, the lumbar spine, and a neurological exam. When patients are diagnosed with sacroiliac joint pain, it doesn't mean that they automatically need an invasive procedure. Conservative treatments will include the use of anti-inflammatories, physical therapy, chiropractic, and even the use of a sacroiliac joint belt. If these options fail, then we typically offer patients a fluoroscopically guided injection of local anesthetic and corticosteroid. If all of these options fail, then we will begin discussions with patients regarding a sacroiliac joint stabilization procedure.
I felt well prepared for this procedure because I talked to my doctor, and I trusted him, and he gave me enough information that I could take it home and read it and talk to my family about it. I just felt secure.
The iFuse INTRA X procedure involves the placement of 2 small cylindrical bone allograft implants directly into the articular portion of the joint for immediate stabilization. The total time of the procedure takes approximately 1 hour.
I'm back to line dancing, just very pleased with the outcomes. It's such a relief not to have the pain.
If you are struggling with chronic low back pain and you've tried several conservative treatment options that have not been successful. We would love to have the opportunity to meet you, discuss your symptoms, look at your imaging, and see how we can help.